Hello, I'm Tiffany Cloud. Welcome to Better Together in Hazleton. I'm right here at the Greater Hazleton Rails to Trails, a place where people come to run, to bike, to walk. And that's a lot of fun, but unfortunately, not everybody has mobility. Some people really struggle with mobility issues because they have problems with their hips. That's why I'm so excited to shortly be joined by Dr. Anthony Favello of Coordinated Health to talk about an interesting new procedure being offered right here in Greater Hazleton with Coordinated Health.
1, 2, 3.
As student athletes and weekend warriors get the same injuries as the pros, but not the same sports medicine. That's adding insult to injury. Luckily for you, there's Coordinated Health. First string, first rate, and rated first in the region for advanced sports medicine with pro-level care. Coordinated Health. Better together.
Welcome back to Better Together in Hazleton. So I'm here at the Greater Hazleton Rails to Trails with Dr. Anthony Favello of Coordinated Health. And as I said as I opened the show, unfortunately, not everybody has the ability to walk. Some people really struggle with mobility, but you're someone who can help them out with that.
Yeah, that's true. I mean, it is a beautiful day here at Rails to Trails. Sun is shining, birds are chirping, everybody's out, but not everybody can enjoy this, particularly those people who have issues with their hip. Even just getting up and walking around their home is a real struggle for them.
And we're going to definitely be talking in this episode about an exciting new procedure that you offer at Coordinated Health. But before we do that, I really want to start here at the Rails to Trails of Greater Hazleton talking about your ties to the Hazleton area. So if you could tell the audience a bit about that.
Sure, actually, yeah, I have very strong ties to Hazleton. I'm the fifth generation of Favellos to be here, and we came over through Ellis Island with my great-great-grandfather. He was a mason and did a lot of some of the work you even still see around town on Diamond Avenue and things like that, still standing. And then his son went on and started the Favello Law Firm, which has been in my family since 1923. Unfortunately, I just didn't find a lot of that interesting, so I went to medical school. And when I was a kid growing up here and playing sports, orthopedics really appealed to me. I actually watched one of the surgeons at that time operate at St. Joe's, and ever since then I decided I wanted to be an orthopedic surgeon. It's one of the best jobs in the world, in my opinion. Coordinated Health brings something to the table that maybe they haven't had here before. When I was a kid and I was growing up here, I was involved in a lot of sports, and I remember, turning an ankle and going up to the hospital and seeing one of the orthopedic surgeons. And when I was a kid back in the 90s, and we had a lot of great care. We had 3 orthopedic surgeons who were dedicated to the area, and they were here for a long time. Unfortunately, in the 2000s, we lost some of that. We had about 10 surgeons who weren't from the area come through town, and they didn't really have roots here. So when I decided I needed to find a place to practice, I knew I was coming home to Hazleton because we so desperately needed care here. And Coordinated Health has a lot to offer, and we're going to talk about some of that.
And I'm glad we are, and I am glad that you're in Hazleton and staying in Hazleton and offering these wonderful services to our community. And what we're going to do next, we are going to head down to Dr. Favello's Coordinated Health offices in the Greater Hazleton area, and we're going to learn a lot more about a unique new procedure for hip replacement. So stick around, we'll be right back.
Here at Coordinated Health, we all work very well together interdepartmentally as well as in rehab. I do work the rehab area, and it's very hands-on here. Our patients are just not thrown on a table and told to do their exercises. We listen to what they have to say, and we tailor our rehab to their response for that particular day. So I chose Coordinated just because of the way we worked better together.
One, two, three.
As student athletes and weekend warriors get the same injuries as the pros, but not the same sports medicine. That's adding insult to injury. Luckily for you, there's Coordinated Health. First string, first rate, and rated first in the region for advanced sports medicine with pro-level care. Coordinated Health. Better together.
When I first started noticing it, it was probably about 4 years ago. You know, every once in a while I'd get bothered. Like, it might have happened like a couple times during the month that I'd get some pain, and then I wouldn't feel it for a while, and then it would come back. If I tried doing the activities I did, I was just in too much pain.
Coordinated health really has the best of what orthopedic medicine can offer, okay? We do things and we take pride in them, and when we treat a patient, we treat the patient as a whole.
When Dr. Favela looked at the MRI, he thought it was that a vascular necrosis. And he pretty much came out and told me, well, we can do a total hip replacement, and that's what I was going to need. I don't think I was surprised when he told me I needed total hip replacement. I just know all the pain I've been putting up with, and I was putting up with it too long.
Hip replacement has been around for years, but there's been an emerging technique to use an anterior approach for the hip replacement, in which we do the hip replacement through an incision towards the front of the hip. This has the benefit of going between the muscular layers and straight down to the hip joint, and very little muscular dissection. It also has the added benefit of letting us do the surgery under X-ray, which provides a much more precise placement of the hip replacement than it does the traditional way.
To go to Allentown to have the surgery done was definitely worth it. Yeah, it was definitely worth it. When I went in to get it done, I went in on a Tuesday and I came home on a Friday. They set everything up for me. I was able to go into my own town that I lived in. There was a place that has physical therapy.
She recovered well after the surgery and is walking much better and having significantly less pain than she did before the surgery. It's really impressive, and in fact there's no hip precautions, which is a common thing with posterior traditional hip replacement. You can't cross your legs after surgery, you can't sit on low chairs. With an anterior hip replacement, you don't have to worry about any of those things.
I went to physical therapy like 2 times a week. Some of the things I had to do were hard, but actually when I would leave physical therapy, I actually felt better.
We do everything we can for all our patients, and we do everything we can to get them back to the lives that they want to live. We hold ourselves to a higher standard, and I believe our facilities and our physicians show that.
It's going on almost a year since I had the replacement done, and it's great. Dr. Favela is a really nice doctor. Any questions I had, he answered, and I do recommend Dr. Favela.
Coordinated health takes a team approach. I chose coordinated health because of the manual training that we do. All of our staff is trained by our senior therapists coming in. We emphasize hands-on patient care, which is very crucial to the rehabilitative process. When you put your hands on a patient, they develop a trust in you, and that helps the patient progress through their problem.
The most common injury we see in basketball players is called the inversion ankle sprain. We see it most often in athletes who are going up for a rebound or catching a pass and they come down on another player's foot. The ankle twists and rotates, it puts a stress under the ankle ligaments and it causes them to tear. Most ankle injuries are able to be treated conservatively with physical therapy, ice, elevation, and either an air cast or a walking boot. There are times where we'll have to go in and repair the ligaments because the ligaments have been so torn that they have to be reapproximated with suture. Research shows that athletes who are treated with an athletic trainer or physical therapy as soon as possible can have as much of a 50% reduction in healing time compared to those athletes who just let it heal on its own. Preventative measures include making sure that they're wearing high-top sneakers that are tied and laced appropriately, making sure that their ankles are either taped or braced, and in patients who have unstable ankles, we recommend actually doing a combination of both bracing and taping.
Because you're a weekend warrior, we have Saturday surgeries. Another reason our sports medicine team is #1 in the region. Coordinated health. Better together.
Welcome back to Better Together in Hazleton. I'm here in a treatment office with Dr. Anthony Favela, and we're going to talk a bit about the procedure now. I'd like to start by asking you, who is a good candidate for the procedure?
Well, anterior hip replacement is something that's kind of new and evolving. It's been done before years ago, but it fell out of favor for an easier typical approach we would call posterior hip replacement. Candidates for an anterior hip replacement, it varies widely, but pretty much anybody who has significant arthritis in their hip and is having significant debilitation, limiting their activity, they can't walk as far as they used to, they can't do the things that they used to enjoy, they're a good candidate for an anterior hip replacement. Certain body types are easier to do than others, and that's typical of whether you do it from the front or from the back. Anterior meaning from the front, posterior meaning from the back. But pretty much anybody who's suffering with hip arthritis is a candidate for an anterior hip.
Okay, now if a person's thinking about having this procedure, what can they expect in terms of what's involved and, of course, the recovery process?
It's a long process, okay. Obviously, there's an initial visit with myself or, a surgeon who's going to be performing the procedure. Basically, what we do is we take all the information at that initial visit and then we assess, is this patient a good candidate for this procedure? Have they tried everything else other than surgery? We don't always go right to surgery on the first visit or every time we see somebody. One of the problems with hip arthritis is we're very limited in our treatment of hip arthritis. Non-surgical treatment options will do nothing to reverse the arthritis. We can't do that. We don't have that kind of technology. But there are other things that can be tried, and we usually try those things first. When they have failed, and hip replacement is the only option, then there's certain things that need to be done. We need to get you to see your family doctor, make sure you're healthy for the procedure. We order some blood work, some labs, and it usually takes about 4 to 6 weeks from the time that you decide to have surgery till you get scheduled and actually get the procedure done.
Okay. This type of procedure that you offer here is less invasive than other types of procedures. I know you have this really nifty model sitting right here, and I'd like you to walk the audience through what makes this procedure unique.
So what we're looking at here is a model of a pelvis, and we're looking at both hips, okay? What you're seeing here on the outside, on this right side here, is a plastic covering that's representative of the skin. Deep to that, we have the muscular layers of the hip, which are covering the bone. On this side, in this model, they've made the bone look like glass. It's transparent plastic so that you can see through it. And what we're looking at on this side is a hip replacement. What we've done is remove the arthritic parts of the hip here, the ball part of the hip and the socket part of the hip, and replace them with a metal stem that goes down into the thigh bone or the femur and a metal cup that goes into the acetabulum. The acetabulum is the cup component of the hip. Inside that metal cup, we put a plastic liner, and this pink ball here is a ceramic head, and that becomes the new joint surface. That's where the hip actually articulates. On this side here, we're talking about approaches to the hip. How do we get to the hip joint? On this side here, what they're showing you is a very easy anterior approach. We make the incision on the skin in the front of the hip, and we actually come down over this muscular layer and put our finger and go right between these two muscles here. And I'm going to remove this for simplicity's sake to show you. We have hip joint underneath. This light blue covering here is the capsule of the hip joint. So it's very easy to get to. It doesn't require any significant dissection of muscle, which saves the patient pain. In a typical approach for a hip or a posterior approach, looking at it from the side, we have to split the gluteus maximus muscle and this muscle here, tensor fasciae lata, and we split those and dissect them and pull them out of the way to do the hip replacement. That muscular dissection does seem to cause increased pain, and patients who typically have the hip done from the back have more pain and a longer recovery than they do if we do it from the front. The other thing that's important, which we may see underneath here, are these muscles. These muscles on the back of the hip, we call the short external rotators, they give the hip stability. They're what makes the hip, holds the ball into the socket, and they're very important. On a traditional hip replacement, we do remove these. We peel these off to get to the back of the hip joint. With this procedure, they're totally preserved. We're going right down to the front between the muscles, and we don't have to violate those at all. What that means for the patient in terms of recovery is that they don't have to worry as much about the hip popping out of the joint. That's a real problem for posterior hip replacement. Now the numbers say it only happens about 5 to 7% of the time, but if you could reduce that to 1% or less, then why wouldn't you want to do that?
As we said earlier, this definitely seems like a far less invasive approach than the other.
It is. And each approach carries different risks, but the benefit of this approach is, going between the muscles, not having as much muscular dissection. We've seen people come in at 2 weeks after surgery walking without a cane.
Is that right?
It's really impressive, yeah. Whereas a typical posterior hip replacement, they're using a walker at 2 weeks. And most people by 2 to 3 months are walking pretty normally.
So after someone has this procedure, which takes about how long in the
About
operating
2
room?
hours in the operating room, yeah.
Okay, so after they have the procedure, what would they expect within maybe the first 24 to 48 hours?
Of course. Typically what you would do is you'd stay in the hospital for about 2 to 3 days. There are places where they're shortening that up. Some places are even doing outpatient surgery where they do an anterior hip replacement and the patient goes home the same day. I'm not comfortable with that yet. I prefer to follow my patient overnight at least and see how they're doing. So typically you're in the hospital for 2 days. This does require use of a special table, which is only available at Coordinated Health, and that's in Allentown. The thing about that is, what's really nice is your therapist, you have a whole team of people around you who are familiar with anterior hip replacement, because the rehab protocol afterwards is totally different. One of the big advantages of anterior hip replacement is this low risk of dislocation, meaning low risk of the ball popping out of the socket.
Okay.
And that's a problem with the posterior hip replacement.
Is
it really
that right?
is. Yeah. So after a posterior hip replacement, you have to sleep with a pillow between your legs. You can't cross your legs. You have to be careful sitting on low chairs and toilets and things of that nature. With an anterior hip replacement, there's none of that. And we start that process right away. And the day after surgery, we will get you up in the hospital. We will get you walking.
Really?
Yeah.
Within the first day?
Yeah.
Oh my goodness. Okay.
Yeah, and we'll have you walk in the halls. And before you go home, you will have done stairs. You'll have walked the halls. You'll be able to dress yourself and feed yourself and all those things. We test all those things during your short 2 to 3 day stay in the hospital. One of the other benefits of the hospital in Allentown at Coordinated Health is it really is patient-centered. You know, we focus everything around the patient. We pride ourselves on having a 5-star rating by CMS, which is a government agency that regulates Medicare, for patient satisfaction. And we're one of the only hospitals to have that. There's only 6 in Pennsylvania. We're the only one in the Northeast Pennsylvania and Lehigh Valley who has that. And that's because if you have a hip replacement done at our facility, the facility's beautiful. The room is like a hotel room. You get a big screen TV, a couch where your significant other can stay. Yeah,
That's nice.
It's crazy. Yeah,
and that's good, because sometimes when you go to the hospital, part of it is it feels so cold and it feels so clinical.
And you're sharing rooms and things
nice
like that.
It's warm.
You don't have to do that. You get food off a menu. We get you back in your regular clothes and out of the hospital gown as soon as we can. I even had one guy once ask me, I did his knee replacement before the Super Bowl, and he asked me if he could stay another day so he could watch the Super Bowl on the TV in his room. So it's a really nice place. It's a very good experience.
So after you're in the hospital for, say, 2 or 3 days, and you outline some of the expectations that you're pretty much walking within short order and what you're doing to support that. What happens maybe a week later, 2 weeks later, in terms of the post-operative support and procedures that you do?
If you need it, when you go home, you will have nurses coming into the house and they'll be looking at the dressing, maybe changing the dressing, and sometimes even doing therapy at home for you. A lot of people with the anterior hip replacement don't need that. They can change the dressing themselves because it's right there, it's easy to access, and it's not located, you know, in a place where you can't really reach it. So the therapy is frequently done on an outpatient basis, and we have excellent therapy here. So you come here for your therapy in the office, which is nice because we're very familiar with the anterior approach and we know that the rehab protocol is different. And you know, you go through therapy anywhere from 4 to 6 weeks, some people maybe 8 weeks, it depends on how you progress. And usually by 3 to 4 months, you're walking pretty well, and that pain that you had in your groin and in your hip is gone.
So is there a point at which the majority of patients have virtually a full recovery?
Yeah, it's a little earlier in my opinion for the anterior hip replacement. That point comes to me maybe in the 3 to 4 month mark, whereas for most patients with a posterior hip replacement, you're looking more like 6 to 9 months. So that's one of the big advantages. In addition to not having to sleep on your back with a pillow, not having to worry about dislocation. The other advantage for us as surgeons is we do this with the patient on their back. When we put a patient on your side, it's very difficult to use x-ray during the procedure.
Oh.
This procedure is done entirely under x-ray. It helps us position the components very specifically, which is really important in hip replacement for having a good outcome.
So that's nice. I mean, it's always good when it takes the stress off the doctor as well, because you want to be at your very best when you're doing any procedure.
It's better for the patient in terms of their recovery. It's better for us. It makes us more accurate as surgeons. I think, you know, this has been gaining popularity across the country. In the last 4 or 5 years ago, if you went to a conference and said how many people are doing anterior hip replacement, you know, maybe 5% of the surgeons would have raised their hand. Now it's up to 25%, and it's growing because the technique has gotten easier with the use of the table and the fact that we can get things right so much of the time, and also the patients recover quicker. It's just a better way to do a hip replacement.
But it's interesting that even though it's up, it's still at 25%, and the fact that we offer something this innovative right here in the greater Hazleton area, right here in our community. I mean, we're really cutting edge.
Yeah, and I try to stay on that edge. You know, that's what's difficult about being a surgeon, you know, not to jump on something too soon and then find out later there's a problem with it, and, you know, also to use the old standards that are reliable. This, in my opinion, is the best of both worlds, because you get the old standard of hip replacement, which does wonderful things for relieving pain, and you can do it in a different way. It is technically a little more challenging for the surgeon, but that's part of the learning experience, and I think the potential benefits are there that it's worth taking the time to learn it.
Well, we like things that make your job easier, make the patient's pain lower, make recovery easier. I mean, that all sounds wonderful, and we certainly like it when it's right in our community.
Yeah.
You sound really excited to be here with Coordinated Health.
I am, yeah. I've been a part of Coordinated Health since 2012. Coordinated Health has a lot to offer our patients, and, you know, even though we sometimes do have to operate outside the area, most of the care is provided here. You know, our office visits, our physical therapy, we have excellent pain management, chiropractors, foot and ankle doctors, even primary care here, and that's a big advantage in my opinion, to our patients.
And what we're going to do after the break, we are going to talk further about the Coordinated Health continuum of care. We'll be right back.
Yeah, as I've told people so many times before, the big difference with Coordinated Health is we have the ability to communicate with all of the providers that are under one roof. So the patient gets excellent care with excellent ability for all the providers to communicate in regard to what's going on with their care and what our next steps are. So the patient really gets the whole realm of healthcare under one roof.
Welcome back to Better Together in Hazleton. Before we talk about the continuum of care right here at Coordinated Health, I have a couple more questions about this procedure.
Sure.
I'd like to specifically ask how long, if a person has this replacement, how long can they expect it to actually last?
We expect that they'll last about 20 years, but our newer laboratory data on some of the newer materials we're using in hip replacement says that they can last longer. We expect reasonably up to 30 years. The longevity of the hip replacement is dependent upon a lot of factors. Obviously, every time the ball cycles through the socket, you get some wear on a microscopic level. If you use the hip harder than the average patient, you might wear it out a little quicker. But for most people who are in their 60s and 70s, they're really good candidates for hip replacement because it's most likely going to be their last one.
Exactly, 20 to 30 years. They got to love that, because you don't really want to have surgery when you're that much older. You try to avoid it as much as you can, and that's wonderful.
And that's true, and it actually brings up an interesting discussion, which is kind of a hot topic in joint replacement literature is, you know, what is the appropriate age? When can you start doing hip replacements? Well, unfortunately, there are degenerative conditions of the hip where the hip can go bad even in somebody's 20s or 30s. And while we definitely try to avoid operating on people that young or in their 40s even, sometimes it's necessary, because if you think about it this way, even though the second procedure is always a little more complicated, when would you rather have those quality years? You know what I mean? So would you rather have a hip replacement if you have a horrible hip and have it in your 40s and get a good next 20 years, or suffer through until you're 55, 60 years old, and then have those quality years later? I mean, in my opinion, if a patient is suffering, even if they're young, and there's no other treatment option, if it were my hip, I would want that hip replacement so I could have those good years when I was young.
Me too.
Right.
My other question is regarding rejection rates, because you know, I read online and press a lot about sometimes hips replacements are rejected.
Yeah.
What is the rejection rate here?
It's really, really rare, and it's not rejection. We talk about metal allergy, you know, when we talk rejection, and it's less than 1% of the population. It's really uncommon. When you see all these ads on TV about attorneys and hip replacements that have been recalled, those were mechanical issues and things that were inherent in the design that were not, we didn't know at the time, but it didn't prove to be a good thing. So one of the big things is this metal on metal hips. We don't do metal hip replacement pretty much anymore because we found people were having reactions to it. The small amount of metal debris could cause reactions inside the body that weren't infection, but they were a real problem, and a lot of people with certain types of metal on metal hip replacements had to have them redone. I don't do any metal on metal hip replacements at this time. I do think that they may be appropriate in the right situation, but we have better technology now, and I don't think it's as necessary. One of the reasons people did metal on metal is because the size of this plastic liner in the cup is really important for stability. The bigger the ball, the more stable the hip is. With a posterior approach, you would want that big ball to make it really stable, but you are limited by how thick the plastic cup is. If the plastic cup is thinner, then there's more stability because the ball has more range of motion. With an anterior hip replacement, we don't have to worry about that. We can use a smaller ball. We can make the plastic nice and thick, which gives the hip longevity, helps it last a long time, and that's really a benefit to the patient.
This procedure sounds fantastic. It really, really does. It's exciting stuff.
It is.
Other exciting stuff, you have a wonderful continuum of care right here at Coordinated Health in Greater Hazleton. You have a wonderful team approach. If you can tell the audience a bit about that.
Sure. Well, Coordinated Health is really a company that's defined by its name. Coordinated Health means coordination of all aspects of our teams to bring you the best possible result in your care. And the founder of Coordinated Health, Dr. Diorio, was a believer that when he started the company back in the 80s, and in the 90s it progressed and grew, and the same in 2000s. And what we have now is a big company with all different services in the medical care spectrum, and that provides, in our opinion, a great result to the patient. Typically for an anterior hip replacement, you will be seen not just by me, the orthopedic surgeon. You will also see a family doctor, whether it's here or your own family doctor. You may or may not have seen one of our pain management specialists. You will definitely see our therapists, and you'll see a lot of them, and they're really good. And all those things coming together really provides the patient with the best possible outcome.
And a person can go online, there's a place they can go and read about the continuum of care?
Yeah, absolutely. Coordinated Health's website, coordinatedhealth.com, has a lot of resources. Not only will you get information about your surgeon there and a little biography on him or her, but you'll also get information about your condition. You'll also get information about our team approach, our philosophy. Better together is really something that we believe in, and we strive to achieve that every day. And the great thing about Coordinated Health is we're a leader in the service industry. Medicine is a service industry, just like many industries. It used to be that medical care was a necessity. Well, that's not how we believe it should be. We want to provide our patients with the best possible service that we can, and we think that we do that a little bit better than some of the other groups out there.
So Dr. Favello, if people want to learn more about you and about the wonderful procedures that you offer right here at Coordinated Health, where can they go?
We have excellent information on our website, coordinatedhealth.com. It's about all the services that we offer, orthopedics in addition to the other medical services that we offer. And there's a lot of valuable resources there, not only about your physician, but about your condition and what's available to you.
Well, I thank you so much for taking the time with me and the audience today. We really appreciate it, and we're so excited you're here right here in the Greater Hazleton area.
Thank you.
And remember, everybody, let's get better together in Hazleton. Thank you for watching, and be sure to tune in for our next episode.